When you look in the mirror, do you lift up your face with your fingers and smooth out the wrinkles and sagging skin and wonder, well, it's inevitable. We all age. So what can you do to turn back the clock? Let's get answers about facial rejuvenation surgery from renowned plastic surgeon. That's Dr. George Toledo. He's here, and he brought with him also one of his patients, and that's Rhonda. Good morning to both of you guys.
Good morning.
Good morning.
We're going to get to Rhonda's beautiful story, but let's talk about your approach, Dr. Toledo, when it comes to facial rejuvenation surgery.
Well, basically, Amy, I treat the face usually completely. I mean, the brow, the eyelids, the face, and the neck, and everything needs to be lifted a little bit and pulled and excess fat removed, and it has to be harmoniously done so it all looks natural. You want the neck and the forehead to look the same age, and in some people the eyes age faster, and others the neck, but you got to take it all together and just do it all in one stage.
Symmetry is a big word that I'm hearing when you talk about balance. So Rhonda came to you. What were her concerns, and what was your approach after her initial consultation?
Well, Rhonda needed her eyebrows lifted just a little bit. She had a little bit of excess skin in the upper lids and some excess fat in the lowers. The face and the jowls was sagging a little bit, and then she had extra skin in the neck. So we took all four components, and in one sitting, in about 4 hours, it was all lifted and tightened. You know, it looks and worked, you know, as expected.
Right. Rhonda, you look fantastic, so let's talk about your results. I think you look incredible. What do you think?
It was better than I actually even expected.
Wow.
I very much wanted to look like myself, just a little better, and it was amazing. I couldn't believe it.
It's a big decision to make, so I'm sure you thought about it for a long time.
A long time.
So you look amazing. So what did the process start like? How did you find Dr. Toledo?
I have a very good friend who is a lot better than I am at research, and she said he was the best. She had talked to several friends who had work done, and I just followed her. I followed her lead, and I said, well, if you've already figured it out, that's what I'm going to do. I'm going with Dr. Toledo. Dr.
Toledo, I'm sure a lot of people are referral from your business because obviously they're walking billboards. You see beautiful women like Rhonda who are happy and have amazing natural results. I'm sure that's a big part of it.
Well, you know, if you do good work, you don't need to advertise. I mean, they advertise for you. And so guys that keep doing mediocre results, they're constantly running ads because their patients don't give them word-of-mouth referrals. So that's really where you should get your referrals.
Okay, and Rhonda, obviously you're looking good, feeling good.
I feel great.
And I heard you went to a wedding right after your procedure.
I did.
You got to celebrate and show off your new looks.
That's correct. 3 weeks after, I was at a wedding in New York.
That's fantastic. Well, I think that you look really good. And Dr. Toledo, obviously, this is, you know, not a middle-of-the-day procedure. This is something you would make an appointment for and have a consultation to see what exactly the results are that you can expect.
Right. This is not just some little, you know, let's just laser this or Botox that or put a little filler. This is, you know, actual surgery. I mean, it's safe and it's easy if you know if you do it with experienced hands and. But it turns the clock back.
Yeah, well, Rhonda, you look great. Thanks for sharing your special story with us today on GMT. And Dr. Toledo, always very good to see you. And again, for more information, this is the number you need to call, 214-363-4444. Or you can check out Dr. Toledo's website at toledoplasticsurgery.com.